Assalamu alaikum wa rahmatullah.
You all have this.
Praise be to Allah, cherisher and sustainer of the universe. He perfected our faith for us, completed His favor upon us, and chose Islam for us as our religion. Praise be to Allah. We seek His help, ask for His forgiveness, and repent to Him. We seek refuge with Allah from the evils within ourselves and from the burden of our evil deeds. He whom Allah guides will never be misled. He whom Allah leaves to stray will never find one to guide him. I bear witness that there is no deity worthy of worship except Allah. Glory is His, alone, having no partners. And that Prophet Muhammad, may the peace and blessings of Allah be upon him, is His servant and messenger, who was sent by Allah as a witness, a bearer of glad tidings, a warner calling unto Allah by His leave, and a guiding light. May the peace and blessings of Allah be upon him, his household, his companions, and all those who follow his guidance until the day of judgment. Subject of today's talk is interesting and important. I don't smoke, by the way, just cough. I did smoke, by the way. When we went to medical school in 1964, we were supposed to be sort of grown-ups, very proud. And in the dissecting rooms, the smell was bad. So our peers, the professors, sort of encouraged us to smoke. So the smell of tobacco would be better than the smell of formaldehyde and dead bodies. I was lucky. Excuse me. Almost everybody who starts smoking hates it. It irritates the airways. But peer pressure forces people to continue. So everybody around you smokes, so don't chicken out. Smoke, go on, it's fun. So they do. And then before long, they get the kick, and then it's difficult not to continue. Why is smoking so addictive? Well, it's simple. It's chemical. We smoke nicotine, among other things they don't talk about, and that would cause some reaction in our brain between the dopamine and the noradrenaline. And that is a very pleasant feeling. So you feel sort of relaxed, euphoric, happy. So when you enter into an argument, you say, let us light up, have a smoke. So you sort of relax. But before long, you become addicted and you need to smoke more, to inhale more nicotine to get the effect, like alcohol. And then before you know it, you are an addict. History of smoking is very interesting. It's an American habit, sadly. Not the current Americans, nor the indigenous American people, the Red Indians. Christopher Columbus, when he discovered America 1400 something, he found that the Native Americans smoked. Tobacco was growing wildly, and they smoked the leaves themselves. They prepared tobacco from the leaves, and he brought that to Europe, and it took off big time. So before long, 1500 something, tobacco was cultivated in Europe, in Santo Domingo, apparently. By 1600, it was brought to England. By 1700 something, it has become widespread, and the tobacco industry became developed. But the harm of smoking was not discovered. Early Christians were not happy with the smoking. They thought something, the devil thing. People inhale something and smoke comes out of them. It's very unsightly. So they didn't like it. But scientifically speaking, it was 1602 when there was an English author published an essay titled Work of Chimney Sweepers. Chimney sweepers are like smokers, if you like. They climb into chimneys and they inhale the soot and they get diseases. And the smokers developed similar diseases. Now, the sad thing about tobacco and cigarette smoking is the ingredients, the impurities, the carcinogenic substances. I need to drink. Again, I don't smoke. This is embarrassing but fun. If you buy a box of Havana cigarettes and smoke the pure Havana cigars, I beg your pardon, Havana cigars, you smoke the pure tobacco, you don't get the carcinogenics that are found in the cigarettes. People found 4,000 different chemicals in the cigarettes. You don't see what's inside. The worst is tar. Tar is the worst, and it is the one that causes the majority of cancer. And that is the sad thing. There is a lot of awareness about that, and in Europe people realize that. By the 60s, people discovered the link between lung cancer and smoking. But the tobacco companies are clever. They sell to the third world countries, Middle East and Southeast Asia, and Africa, where people are not highly educated. They don't know much about carcinogenics, and they smoke the high tar cigarettes. The sad fact is that every day, 120 people in the UK die of lung cancer. Full stop. Every day, 320 people die in the UK of smoking-related diseases, not just lung, but other systems. The handout I gave you has got pictures of all the systems and the effect of cigarette smoking on them. So, continuing with the history, in 1798, a US physician called Benjamin Rush raised the alarm, but he was hushed by the tobacco companies. They were very powerful. And by 1920, people linked tobacco smoking and cancer. And 50s and 60s, there was no doubt about the link. Harold Macmillan government in 1962 had the evidence, but they swept it under the carpet because the tobacco giants were very effective, very powerful. The tobacco lobby in the House of Commons and in the government. The late Margaret Thatcher had shares in Philip Morris. It was very difficult. Even Tony Blair, he came to power when? 97. 79 was Thatcher.
No.
Tony Blair, 97.
No, 1997.
1997.
97.
Yes. He had difficulty curbing the effects of cigarette advertisement. And the Formula One guy bribed him with millions to delay banning adverts for cigarettes during the Formula One races. As a young doctor in Malaysia, I was in Malaysia, we used to be paid money by the tobacco companies to go and be in attendance during sports events like rugby, in case someone gets an injury, and we treat them. And the big posters everywhere. Even recently, in the 1970s, the big movie Superman, the tobacco companies managed to pay the movie makers millions to have this huge poster about Marlboro. And Superman's girlfriend was smoking a cigarette. This image that smoking was okay, sportsmen smoke, sportswomen smoke, and it's fascinating, the history of smoking. 70s, you had Audrey Hepburn with the very famous cigarette holder. You don't have this in the handout, but I have it here. Sorry. The Lucky Strike cigarettes were very famous, and women were encouraged to smoke them to stay slim. which they did, because
Well,
smoking
sister, there you go.
takes away the appetite, you see. To have a slim figure, you smoke. You want to have a Mars bar, it's better to smoke a cigarette and not put on weight. The first woman ever to cross the Atlantic in an aeroplane was used to advertise for cigarettes. She had Lucky Strike cigarettes in her bag on the aeroplane. So the image was everybody smoked, and it's posh to smoke. It's the thing to do. Now, tobacco companies have to replace those people who die every year as a result of smoking-related lung or other system disease. So they become very clever. So they have to push hard. I remember so many people as my patients who had lung cancer. The two that are really memorable is a 19-year-old girl from Glasgow. Sadly, any Scottish people here, in Glasgow, they smoke at the age of 5 or 6. They give their kids treats, give them cigarettes. And that lovely girl, age 19, had lung cancer. And as a young doctor, I was giving her chemotherapy. In those days, we didn't have the multidisciplinary meeting groups. We chest doctors gave chemotherapy, so we wear goggles and masks and give. Didn't work really, and they all died. She was the youngest. The oldest of my patients was a 92-year-old, and he was an agent for a tobacco company, Philip Morris, nonetheless. And he was very arrogant. No, 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 he said. Very posh, very English. Smoking doesn't cause lung cancer, Dr. Abdallah. You can't say it's 100%. He's right. Nothing is 100%. Okay. 70% of people get. 40% get lung cancer. 90% get emphysema. But nothing is 100%. Sadly, he ended up getting lung cancer, and it was an awful type of lung cancer. We divide the subtypes of lung cancer into different types according to the cells. There is the squamous cell, which is the one smoking is responsible for. There is the adenocarcinoma, which is sadly not related to smoking, and the tobacco companies use that as an evidence. There you are. They got adenocarcinoma of the lung and they never smoked. Well, we don't know why. I mean, we don't know what causes cancer. And the awful one is the small cell, which is terrible. Usually they live for 3-4 months. He had the worst type, this 92-year-old man, spindle cells, terrible. And he had it in the top of his lung, and it was extremely painful. Bad death. Sadly, because not everybody who smokes gets lung cancer, some people get cocky about it. It happens to them, not me. The chief consultant in the Glasgow Royal Infirmary, where I worked as a young doctor in Glasgow, was a chimney smoker, a chest doctor, and he used to smoke. And he used to say to me, Said, if you reach the age of 55 and you don't get emphysema, you will never get emphysema. He's right. But how do you know that you will be lucky to smoke and reach the age of 55 and not get emphysema? He retired in 1981. 10 years later, he died of a stroke, and smoking causes strokes. It clogs the arteries in the brain and clogs the arteries in the heart. It causes heart attacks. It causes strokes. Poor thing. So, what does smoking do? It's slow death, full stop. It is suicide, but a very slow suicide. But sadly, people do not listen. I've been talking about this for almost 25 years. I remember the first time was 1990, 92, on the NBC television in Arabic. And they argue with me, the presenters. But you know, it calms the nerves. It takes away the stress. And yeah, I tell them, yes, it does, at a price. Nowadays, you pay £10 for a packet of cigarettes because it's a Russian roulette. You know the Russian roulette game? You have a pistol with 8 compartments and you put one bullet. So you hold it to your head, perish the thought, and you fire. If you were lucky, you escape. You get the empty hole. Next one fires, empty. But one will get the real thing. And it's amazing, everybody thinks it's not going to be him or her. If you tell 1 in 8 smokers gets lung cancer, full stop. Fact. If you tell 8 people crossing the road that definitely one of them will be struck down by a car, they all will not cross the road for fear of being stricken by the car. But you tell 8 people who smoke that one of them will get lung cancer, everybody thinks it's not me. It will not happen. Now the handout. The writing is a bit small, so I got myself lens. But I'm old, and my eyesight is not good. Now, top left corner, the danger of smoking on, we all know about
You all got that.
mouth, throat, lips, nose,
Anytime.
lungs. What does it do to the lungs? It destroys lung tissue. Lungs are made of tubes and air sacs. The tubes take the oxygen down to the air sacs. The air sacs are surrounded by blood vessels, and the blood vessels take the oxygen from the tubes and deliver it to the blood, and take the carbon dioxide back from the blood to the airways, so we exhale. We inhale, we get the oxygen. We exhale, we get rid of the carbon dioxide. These air sacs are destroyed by the impurities in the cigarette, mainly tar, but there are many other substances. And it does not regenerate, not like the liver. Liver gets damaged, it can regenerate itself. Lungs do not. So they end up with destroyed air sacs. The lungs enlarge to make up for the lost ability to get oxygen. And that's the word emphysema. It means in Greek, big lungs.
Big lungs.
And I always try and frighten young people who smoke. I tell them to experience, to feel what it's like to end up with emphysema, which is very simple. Take a deep breath and hold it. And hold it, don't breathe out. Then try and breathe in and out on top while holding your breath. Try. You can't. You can't breathe in and out while holding your breath. That is exactly what people with emphysema feel 24 hours a day. That's emphysema. It's a death sentence. But they don't die instantly. They die after suffering awful quality of life for years. And it's terrible. At the end of the day, the lungs cannot take oxygen, so we give them oxygen. And doctors are clever. They invent new things, but they cannot replace lungs. So we give them an oxygen machine. We call it an oxygen concentrator, which is as big as a mug. And that takes the air, makes it into oxygen. And they put the nasal thing in their nose, and they put it in their pocket, and they breathe. And they walk around, and they go dancing, and they go shopping, and they are happy. But they end up dying of emphysema. And they can't give up. And you can't reason with these people, because the habit is too difficult to get rid of. And I remember conversations between me and my patients who I failed to convince them. And I try and scare them. Early death, I say. You don't want to die early. They say, how long would I live if I don't give up smoking? And I try to be polite. I say, maybe 5 years. Okay, when I give up smoking, how long would I live? And I try to be generous. I say, maybe 15, 20 years. I don't want to live 20 years. I'd rather die after 5 years and enjoy myself. Useless. Useless. Can hardly walk, can hardly do anything. And that generation is now 70 or 80. And sadly, the wives look after them. If I were a woman, I would leave him. What's the point? She's pushing him in his wheelchair, and he's on oxygen, and he's useless, cannot do anything. Now women, young women, are taking up smoking because it's something that men enjoyed and they didn't. But I warn them, those women, when they are 60 or 70, they will end up in wheelchairs with oxygen masks, but there will be no man to push the wheelchair. Men are not faithful. We all know that. Women are faithful. They stick to the husband. They stick by the husband, the majority of them. For better, for worse, for richer, for poorer, for sickness, for health. Men do not believe in that. So she'll end up dying of emphysema, lonely death. And they end up dying an awful death. If they don't die of emphysema, like my boss, Sinclair Kennedy, may Allah bless his soul, he taught me everything, and I have a soft spot for him. I went to his funeral. Sad, he smoked like a chimney. So lung cancer, 120 people every year. Breast cancer is the second killer in women, but now is becoming the first killer because breast now is being treated. They've discovered new ways of treating breast cancer, genetic therapy and things. So lung cancer became the top killer in women as well as in men. Cancer of the esophagus, gastric cancer, because we inhale the smoke, we swallow the smoke, and it irritates the lining of the stomach and it causes lung cancer. We can detect lung cancer early as physicians. It costs money. And in the UK, sadly, money is more important than people. For instance, we have guidelines. You see, doctors and guidelines. I always teach my young doctors, guidelines are rules for the fools, which it is true. But every doctor is frightened of the government. They follow. Give you examples. People who have indigestion could have gastric cancer. The guidelines in the UK is not to refer them to have endoscopy, that to look into the stomach, unless they have the indigestion for 4 weeks. As a result, when people diagnose gastric cancer, stomach cancer, it's too late, they die. In Japan, 2 days of indigestion, they look down the stomach. They detect gastric cancer, stomach cancer when it's very early. They remove it and they live. Survival rates of stomach cancer in Japan is second to none, is top whole world, because they don't have the stupid guidelines we have in the UK. Why do we wait 4 weeks in the UK? Because endoscopy costs money. Selection of patients. Similarly, I'm a chest man. I x-ray my patients who have lung disease caused by smoking, either emphysema or chronic bronchitis, every year, whether they need it or not. If I can see the cancer when it's 1 millimeter, 2 millimeters, actually the ordinary x-ray shows it when it's 5 millimeters. But it could be there and I don't see it. And sadly, I have patients. I had a lecturer in the university, Imperial College, and I managed to get him to quit. 7 years on, I still see him every year. He comes, I x-ray him. Sadly, there is a spot. And we together go back and get the x-ray of the previous year, and we together could see something like a pinhead that we all missed, because the lung is full of lung markings. If you take an x-ray of the lung, it's not empty space. So that pinhead, you wouldn't see it, neither me, nor the radiologist, nor everybody. But if we do CT scans of the thorax every year for people who smoke, we will see lung cancer when it is so small and remove it and save lives. Why don't we do CT scans every year? Money. Guidelines. In America, they do it. If one is rich, yes, you can get away with it. You smoke and you have a CT scan every year. And I suppose you can see the cancer when it is so small and get rid of it. But you may be unlucky and get the small cell. The small cell, when it's a microscopic shadow, it still spreads everywhere. So you can't win. So the answer is to stop smoking. Now people vary. Some people have willpower. I talk to them, give them the lecture, tell them to hold their breath and see if they can breathe in and out on top. I scare them. They crumble the packet of cigarette, put in the dustbin, leave my consulting room, never go back. Cold turkey for 3 weeks, 6 weeks, doesn't matter. They are all right. Some people it's very difficult. We have the nicotine patch, 20% success. We have the gum, 20% success. Now we are so lucky. We have the vaping, and it's being glamorized now. The movie stars now are starting to vape. And vaping does not, repeat, does not cause lung cancer. If all the children take up the habit of vaping, here is Leonardo DiCaprio vaping away. People will not die of lung cancer. It's not been tested for a long time. We don't know the long-term effects, but definitely, it does not cause lung cancer. The pure nicotine does not cause lung cancer. There is hypnotherapy. And if you know the right hypnotherapist, the success rate is 80 to 85%. In Harley Street, some people are so clever, they will give you your money back. You leave the consulting room after hypnotherapy and quit and never see a cigarette again. They make you feel that this cigarette is so filthy. You know, hypnotherapists, we see their shows on television. They give you an onion and they say, this is an apple. Start munching the apple, and you think it's an apple. And you munch the apple, live apple, and you wonder, oh yes, are you enjoying your apple? Yes, it's a lovely apple. It's great. It's golden delicious. Yes, it's golden delicious. So the hypnotherapist will make people think that cigarette is so filthy, it's as if they are eating something vile, and they quit. But some people, sadly, I have quite a few, they don't, they can't. And I sometimes despair. But fortunately, I listen to them. I had a lady who is half Irish, she's Irish, and she married an Indian guy called Patel. She really makes me laugh. She comes every year and says, please, Dr. Abdallah, I want a CT scan. Now the radiation and whatnot, but I have a soft spot for patients. And I know that CT scans would show the early cancer. All right, Mrs. Patel. And she tells me funny stories. When she's waiting in the waiting room, and the nurse comes and calls the name. And she says, Mrs. Patel. She's an Irish lady and she's smart. She stands up. No. I'm looking for Mrs. Patel. She gets a kick. She thinks Patel is Indian. You see. She tells her off. I'm married to a Patel. Anyway, that lady is lucky. Once she asked me for a CT scan 2 years ago, and I repeated the scan. She had a scan the previous year, but never mind. If people ask, listen to them. It's a good thing for doctors to listen to patients. Never dismiss patients. They come to you with the silliest remark. I Googled and I think I have such. The good doctor would say, okay, let's find out. Anyway, send me for a CT scan. Fortunately, in the Brompton, we have the facilities. Money is no object. If you want a CT scan at St. George's or St. Mary's, you have a waiting list of 8 weeks. But I'm sitting in my consulting room and Mrs. Patel asks me for a CT scan. All I do is lift the phone and speak to the radiographer in the CT scan room. And I say, Sally, can I send you a patient? Oh, Dr. Abdallah, all right, since it's you, make sure she has the form with her. You have to write a request form. As it happened, Mrs. Patel had a funny shadow. Did not look like cancer. Now in Brompton, we have experts. We have 5 radiologists, some of them professors. And I believe myself that we physicians could read the X-ray better than the radiologists, but that's being conceited. Because we chest doctors see nothing but chest X-rays. Radiologists see chest, tummy, legs, skulls, barium, you name it. Anyway, that shadow was funny. And again in the Brompton, I have, the other end of the phone, I have a consultant, a professor of radiology. What do you think? He said, send her to the surgeons. I don't like it could be cancer. And I go, it doesn't look like cancer. He said, well, it's up to you. So I phone another radiologist. He says, well, bring her back in 3 months' time and let's repeat the scan and see how it looks like. And that's a mistake. I don't like it. I follow the first one. I send her to the surgeon. We have a great surgeon in Brompton called Simon Jordan. Simon, could you please see her? He sees her within the week. He takes a biopsy. Medicine has advanced so much. Just open a thing like a keyhole. It was cancer. So the other professor of radiology would have been shamed up. Bring her back in 3 months indeed. And she gave me a big hug. Don't get jealous, South, and my wife is sitting up there. She gave me a big hug, and I went and visited her after she had the cancer removed. I don't care, she said. Yes, some people are lucky. She was lucky. But luck can run out. I had a patient who had cancer on one side. We diagnosed it early, sent him for surgery. They removed the cancer. We keep an eye on him. Every year he comes. Then another little shadow in the left side. He told us he stopped smoking, but he was lying. Another cancer. And we removed the other cancer. Imagine. But he's lucky. He came to the Brompton Center of Excellence. Not everybody is as lucky. So, I don't know what to do, honestly. Now, apart from lung, hence the handout, arteries and heart and veins and brains. See, it clogs the inside of the arteries. If it happens in the brain, it's a stroke. Happens in the heart, it's a heart attack. And people die. Simple as that. So heart disease, then cancers, women's health issues, risk during pregnancy. Some pregnant women smoke. Of course, it's hard to be pregnant. Allah, glory is He said in the Quran, وَوَصَّيْنَا الْإِنسَانَ بِوَالِدَيْهِ We commanded man to be good to his parents. حَمَلَتْهُ أُمُّهُ وَهْنًا عَلَى وَهْنٍ His mother carried him with strain after strain. So mothers who are pregnant, it's hard work. So they smoke, especially if they smoke before pregnancy. It stunts the growth of the baby. It causes miscarriage. And there is high incidence of asthma in babies delivered to women who smoked during pregnancy. Cancer of the bladder. Imagine. Cancer of the breast. Cancer of the womb. You name it. And people write on the cigarette packet, smoking kills. Yet they buy it. They spend £10 and buy it and light up. Oh, light up. It's not them, it's going to happen to another way. My friend Mohsin, whom I call him my son who was not given birth by my wife, Mohsin tells me that in Saudi Arabia you can't buy tobacco, and I welcome that. I salute that, if it's true. In Mecca and Medina, you cannot buy cigarettes. And I will quote the verses of the Quran that tells us that smoking is wrong. In Mecca and Medina and Riyadh and everywhere, you cannot buy alcohol. If the government is so good really to ban tobacco in Mecca and Medina, it should be universal. And we in the United Kingdom and everywhere should ban tobacco. What's the point of writing on a cigarette packet, smoking kills, and sell it? You have to be 25. They hide it behind the counter. Like alcohol. another lecture about alcohol, but alcohol also kills, it damages the liver. Do they ban alcohol? No. They make it cheaper and they say, drink responsibly. Really? Drink responsibly. Some people say, oh, I can take a drink, I can leave it, I'm in control. Really? Nonsense. I think they should ban it. Why don't they ban it? Because they get money out of it. Simple. The tobacco revenue gives the Chancellor of the Exchequer billions and billions of pounds every year. A tiny fraction of those goes to treat people who die or get ill as a result of smoking. So it is cost effective. Smoke, get ill, we'll treat you, but we'll get the revenue. Similarly with the alcohol revenue. Where are the verses in the Quran? I got them out yesterday. There are 2 verses in the Quran that talk about harming yourself. Now, if we know for sure that smoking is harmful, then we should not smoke. Is smoking haram? I say it is haram. I am not a scholar. But if I am speaking the truth, my words should carry weight like a scholar. The Quran was revealed 1400 years ago, before tobacco was known, at least in our world, at least in Arabia. There's no mention of tobacco in the Quran. But listen to this, verse 2, Surah Al-Baqarah, chapter 2, verse 195. وأنفقوا في سبيل الله, spend in the ways of Allah. ولا تلقوا بأيديكم إلى التهلكة. Spend in the ways of Allah and do not throw yourselves into destruction. Simple. Each packet of cigarettes is throwing myself into destruction. It's a slow suicide. Because we know, if I don't get lung cancer, I get stomach cancer. If I don't get other cancer, if I don't get any cancer, I get emphysema and the quality of life. The other thing about smoking, if people do not get cancer or emphysema, they get chronic bronchitis. What is chronic bronchitis? Is an inflammation of the lining of the airways whereby they cough and spit. My late father, bless him, smoked because his father smoked. He smoked cigars, but cheap cigars in Egypt, not Havana cigars. He ended up with emphysema. And I remember as a child, 5, 6, 7, all night he coughs. There is this bit of phlegm that he's trying to cough up. And he goes, can't sleep. And maybe an hour later he goes, oh, it came up. My God, fantastic, we're going back to sleep. 5 minutes on, he starts another cycle of coughing to get another bit phlegm up. What an awful life. Chronic bronchitis. The phrase chronic bronchitis was coined in the Brompton Hospital in 1942 by Neville Oswald, a Brompton physician. People before that didn't know there is something called chronic bronchitis. There is so much to offer people with chronic bronchitis. They get what we call frequent acute exacerbations. Every now and then they get a flare-up and they need antibiotics. And here comes the guidelines again. Guidelines. Antibiotics are bad. Don't give antibiotics. And I wrote in the Times and they published my letter. They surveyed 16, no, they said the experts, they are all experts, academics who sit in the offices writing papers. We are physicians who sit in a consulting room seeing patients. So what the academic experts did, they discovered that there were 16 million prescriptions of antibiotics given in Europe, 2016. So they surveyed people to see the effect of that antibiotic, especially the common one, amoxicillin. They asked 2,000 people. I'm speaking like Donald Trump now. 2,000 people. And they made a judgment based on a survey of 2,000 people to find out if the 16 million prescriptions were valid. And the majority of the 2,000 people said it made no difference. Rubbish. So I wrote and they published. Rubbish. They say, resistant. Nothing. Nobody died of resistant antibiotic infection. We can treat them. Believe me, in Brompton, we can treat MRSA, multi-resistant, methicillin-resistant antibiotic, bacillus. It is expensive. It costs us between £700 and £1,000 a day, but we can cure it. North Middlesex Hospital and Northwick Park Hospital and Mary's Hospital and the Royal Free Hospital would never pay this money. They don't tell people we will not pay this money. They say it's a bug, it's a super bug. So don't give antibiotics, otherwise people will develop resistance and have infections caused by superbugs that there is no treatment for. There is treatment for. I treated people with MRSA. You send the phlegm to the lab. Lab is very sophisticated. They get you the sensitivity. Resistant to 20 different antibiotics, but sensitive to one. We get that one. Yes. £1,000 a day, it doesn't matter. How much money do you put on life? Life is precious. So nowadays, if a baby or a toddler is crying all night long, didn't sleep, coughing, take him to the casualty, the accident emergency. A junior doctor looks at him, don't lay a finger on him, and say it's a virus, give them paracetamol. They don't even give paracetamol. Go and buy Calpol from the pharmacy. The baby or the toddler is coughing, take them back to the pharmacy, say the same thing again, take him home, don't waste my time, it's a virus. How do you know it's a virus? I make a diagnosis of a viral infection. I take a drop of blood, send it to the lab, find out which antibody, which virus, and I can treat the virus. And once, twice, 3 times, 4 times in the paper, 6-year-olds, 7-year-olds died at home, having been taken to the accident emergency 3-4 times, not given antibiotics. Typical in the United Kingdom. Inquiries, and they have recommendations, and nobody goes to jail. People die because of the guidelines. Antibiotics are bad. They bribe GPs. They give GPs money incentive not to prescribe the expensive antibiotics. £2,000 a year if you don't prescribe azithromycin, because it's expensive. Azithromycin costs £13, amoxicillin costs £10. Give amoxicillin. If it doesn't work, so what? My wife is a rebel, and that's why I'm so proud of her. She gives azithromycin, doesn't care about this £2,000 a year. And that's one example. There is 10,000 if you don't prescribe this posh medicine for indigestion. There is more money if you don't prescribe that. Cut the cost. It's corruption, big time. My patients with chronic bronchitis, I go back to the chronic bronchitis and cancer and the smoking. I don't wait for them to develop an infection. I give them an expensive course once a month called moxifloxacin, so many of them. Moxifloxacin, 5 tablets, 1 tablet a day for 5 days, every month, whether or not they are coughing badly. They never have an acute infection. People who flying in an aeroplane is hazardous. You are inhaling other people's breath, recycled air. So if someone's sitting in the far back and coughing up bugs, you get it. So my patients who fly never get anything because I give them azithromycin. 3 days of azithromycin, the day before the flight, the day of the flight, the day after the flight. And they repeat the same thing on the way back. Go to your doctor if you are flying and ask for azithromycin. They will tell you, oh, no, we are not allowed to prescribe azithromycin. Liars. Liars. Doctors are very powerful people. Nobody controls them except their conscience. They get away with murder because some of them, I'm sorry to say, are crooked. You go to the doctor and say, can you refer me to Dr. Abdallah in Brompton Hospital? He's a good doctor and I want to see him. My asthma is bad. They say, no, we are not allowed to refer to Brompton. It's a tertiary referral hospital. We send you to Mary's. Liars. They can refer. So you got to be firm with your doctor. Say, I'm sorry, there is something called patient's choice. And I choose to be referred. Don't shout. Don't hit the doctor. Just politely insist. I hear you, doctor, but could you please refer me to the Brompton? They get fed up with you, they will refer you to the Brompton. GPs are very powerful. If they don't refer patients to the hospitals, we hospital doctors will starve. Because if we don't see patients, we close the hospitals. See how powerful the GPs are. So, ignore this guidelines. Guidelines are rules for the foods. I wish the day will come when we will scan everybody who smokes to detect cancer early, when we can do an endoscopy for everybody who has indigestion even for a few days to detect cancer stomach early. We can prevent cancer. Now I started reading and I forgot. We came to the conclusion that وَلَا تُلْقُوا بِأَيْدِيكُمْ إِلَى التَّهْلُكَةِ, chapter 2, verse 193, don't throw yourselves into destruction. Smoking is haram. Take it from me. I don't care about scholars, with the respect. The other verse, it says, وَلَا تَقْتُلُوا أَنفُسَكُمْ إِنَّ اللَّهَ كَانَ بِكُمْ رَحِيمًا. Chapter 4, Surah Al-Ma'idah, no, Surah Al-Nisa, women, chapter 4, verse 29. وَلَا تَقْتُلُوا أَنفُسَكُمْ إِنَّ اللَّهَ كَانَ بِكُمْ رَحِيمًا. Don't kill yourselves, for Allah is ever so merciful to you. If you smoke, you are killing yourself slowly. I've been to Mecca a few times. Thank God my wife is a saint. She goes every year for the last 20 years. I went with her only 9 times. I met Anwar the last time we were together. And I sit there and I speak my mind. And I don't care about those so-called scholars. Because scholars will tell me that smoking is not haram. Nothing in the Quran to say smoking is haram. I say with respect, I don't agree with you. You don't need to be a scholar to interpret Allah's message correctly. وَلَا تَقْتُلُوا أَنفُسَكُمْ means don't kill yourselves. If you take a cigarette, you are killing yourself. That's suicide, that's haram. There are so many scholars who say many things, and I like was different from our subject. Like we had somebody from Kuwait and who spoke. He said, marrying another woman, there is nothing in the Quran to say that a man should take the permission of the first wife. Yes, there is no verse in the Quran that prevents man from taking another wife. But is it right? You're married to somebody for 20, 30, 40 years, and the cheek, the cowardice, you don't tell her, and you go and marry another one. And there are lots of scholars, even Egyptian scholars, Al-Azhar. Yes, it is his right. Tell her. Well, it happened to Muhammad. For some reason, Ali, may Allah be pleased with him, wanted to marry another girl. Fatima wasn't happy. Ali wanted to marry another girl. There is more to the story because the other girl was related to someone who was an enemy of Muhammad at some stage. But that's not the point. The point is Fatima did not want a second wife. The Quran does not say don't marry a second one. The Quran don't say don't have to, you do have to tell yourself to marry another one. But common sense. What did the Prophet do? He climbed the pulpit and he declared, Fatima is my daughter, he said. And what hurts her hurts me. And came down. Ali got the message. Simple. Common sense. Do I have more time? I got 5 minutes. What shall I say in 5 minutes?
Anything you like.
Anything I like. We should end up on a funny note or a happy note. There is nothing happy about smoking, to be honest.
Nothing happens.
I think they should ban smoking. They should ban tobacco. Muslim countries, especially Muslim countries worldwide, should ban tobacco, should ban alcohol, should ban gambling. And I'm so ashamed of Egypt. Yeah, let's end with this funny story about Sharm el-Sheikh and a big rich Saudi man who went to gamble. It is so shameful that we have casinos in Sharm el-Sheikh, and we, the royal we in Al-Azhar, we teach the whole world Islam. And Allah say, إِنَّمَا الْخَمْرُ وَالْمَيْسِرُ وَالْأَنصَابُ وَالْأَزْلَامُ رِكْسٌ مِّنْ عَمَلِ الشَّيْطَانِ فَاجْتَنِبُوهُ. Drinking, gambling, associating things with God, glory is His, is filth of Satan's doing, and don't do it. Yet we allow people to gamble. Let's end by interviewing a celebrity who smoked, who had the wisdom of giving up smoking, and he is very happy. He is no less than the director of photography, Mohsen. Mohsen, tell us, how long did you smoke for? Take the mic and don't be shy.
Putting me on the spot, Dr. Said.
Putting him on the spot.
I'm going to get out of the cameras.
How long did Mohsen smoke?
Yeah, Mohsen, how long did you smoke?
I smoked for about 20 years.
He
just over
smoked
20.
for 20 years.
Yeah.
Speak up. Come and sit. Come and speak in the mic.
Don't be shy.
Don't be shy, come. Please, we want Mohsen. We want Mohsen. We want Mohsen. Yay! Sit down, Mohsen. Come and tell us. When I go to Islam channel, they ask me to bring a patient with me, and I always choose a celebrity patient because it's really very effective to see someone in flesh who had the experience. The microphone.
Mic is there, Mohsen.
How long did you smoke for, Mohsen?
Go closer.
Yeah, I smoked for about 20 years.
And what made you start smoking?
As a child, I was just under peer pressure to smoke. So started smoking at the age, I think it was about more than 20 years. So about 16 years old I was when I started smoking.
What did smoking do to you to make you think of quitting?
To be honest with you, I enjoyed it.
That's honest.
You know what you mentioned about the adrenaline and the
Yes,
euphoria?
the buzz. Yes.
That was like the nail on the head. That's exactly how it was. But
Yes. Then what happened?
it did have its detrimental effect, which was that I ended up with an adrenaline condition which the doctors couldn't quite diagnose. They didn't know what was causing it. And they never attributed it to smoking. So, and that wasn't enough to get me to stop smoking. What actually got me to stop smoking? I mean, there were many reasons, contributory reasons, but none of them were really, even combined, they weren't enough to get me to stop smoking. How I stopped smoking was actually quite an amazing little story. One day I realized I can't serve two masters. I can't be a slave to two. One being Allah, one being the cigarettes.
MashaAllah.
And I realized that I could be committing a type of shirk, albeit the lesser one.
I like the way of putting it.
Very good. Go on then.
Yeah,
Okay,
so-
you're a slave to cigarette.
So what I did was I got the cigarettes, and I actually filmed myself doing this with my mobile phone. I took the whole pack of cigarettes and I crushed them up, and I threw them in the bin.
Willpower.
And I sent the video on WhatsApp to everybody, my parents, my friends,
MashaAllah.
everyone. So now if I get caught smoking, I look like an idiot. So yeah, that kind of helped. I think the first 3 days were the hardest, but they weren't as hard as I thought they would be. Then 3 weeks. Then after that, it was just plain sailing, I think.
Exactly.
What is the benefit you got after quitting smoking?
Getting my taste buds back. But yeah, you tasting. I get emotional when I eat sometimes. I mean,
You are.
you know, I eat strawberries and I feel like a child again.
Were you healthy when you smoked? Were you in the right weight?
I was underweight, but I was still healthy because I'd done a lot of sports.
Yeah.
I was doing a lot of running, free running, parkour. But now that I wasn't like a 20-a-day smoker or anything. You know, I was like in between a social and habitual smoker. So
Mohsen is lucky. Mohsen is lucky because he did not end up with emphysema. People end up with emphysema, they grow so thin. We call it emphysema cachexia. Cachexia means wasting. One of my celebrity patients was Mrs. Castle, the wife of Mr. Castle, the first one ever to have a heart transplant. And she was so thin. She can't breathe. People who have bad emphysema don't eat because if they eat and swallow, they get short of breath. Imagine when you eat, you swallow, you close your airways to swallow. It takes a few seconds. Those few seconds to swallow food deprive you of oxygen. So you can't eat. You become so thin. Now, how much weight did you gain? Tell us. Don't be shy. Since you stopped smoking.
in a year, I think about 22 kilos.
22 kilos.
Alhamdulillah.
There you are. Now, the good news is that Mohsen now is a charming man and he's looking for a wife. So if there is any young lady, he's a good catch, I tell you. Pity, my daughter is a bit old for him. But he's a very good catch. Thank you so much for listening. If you know somebody who smokes, yes, please, but very quickly.
Yeah, thanks very much for staying for the valuable lecture.
Bless.
You mentioned about the cigarettes, the effects and the e-cigarettes. What do you think about the shisha, which is now?
Shisha is bad because it's tobacco. They fool you by thinking they purify it through water. It's the same they put in cigarettes. Is put on top of the shisha. I'm so sorry. Vape is safe. Now, sadly, women take shisha now. It's bad.
Yes, quick.
Yeah, I've heard
Alaikum
that
salam.
vaping is good for you. It doesn't give you cancer. Is that true to tell?
Yes, vaping does not give you cancer.
At the moment.
At the moment, no, it does not give you cancer. But we don't know if it gives you something else. It will not be cancer. It would be some inflammatory lung disease. We haven't tried it long enough.
Okay. What do I tell my husband to quit smoking? Because he's
Tell him what you heard.
No, he started because of stress. So he's only been smoking now a few months.
Does he
and
pray?
can't stop.
Does he pray 5 times a day?
Yeah, he's smoking illegal cigarettes.
Like a showing.
Show him that. Scare him.
I put all the cigarette packs on the back of the front door, you know, to frighten him, you know, all the deadly pictures. Didn't frighten him at all. Now
Get
he's been
him to
smoking
vape.
more since I put the pictures on.
Get him to vape. Vaping is safe.
Abdullah.
Tell him the 2 verses in the Quran. Don't kill yourselves, Allah is merciful to you. And don't throw yourselves into destruction. It's a sin.
You've been talking about smokers. What about the passive smoking?
Bad, another incentive.
That is
Women
not
who
meant.
smoke with children around, children get the very good question. Asthma. Passive smoking can cause cancer. It's very rare, but if you are living with somebody who smokes 60 a day, you are inhaling the tar, you can get cancer. There is a case in the United States when the woman sued the tobacco company and won millions. She got cancer because her husband smoked. Yes.
That's right.
Passive smoking can be harmful. People who have asthma, kids who have asthma grow out of it unless they take up smoking when they are teenagers. They never grow out of it. People who smoke and quit are more susceptible to what we call late onset asthma. They get asthma above the age of 60, which is sad because their lungs have been inflamed for so long. Let's have another lecture some other time. Thank you so much. Bless you.